ꯌꯨꯝꯗ ꯆꯪꯗꯅ ꯑꯌꯨꯁ ꯃꯣꯕꯥꯏꯜ ꯌꯨꯅꯤꯠ ꯀꯥꯏꯅ ꯀꯛꯆꯤꯡꯒꯤ ꯌꯥꯝꯅ ꯑꯥꯎꯠꯁꯀꯔꯠ ꯑꯣꯏꯕ ꯃꯐꯝꯁꯤꯡꯗ ꯆꯪꯗꯅ ꯍꯥꯏꯕꯗꯤ ꯗꯣꯔ ꯁ꯭ꯇꯦꯞꯇ ꯑꯩꯈꯣꯏ ꯑꯌꯨꯁ ꯁꯔꯚꯤꯁꯁꯦ ꯄ꯭ꯔꯣꯚꯥꯏꯗ ꯇꯧꯅꯕ ꯀꯟꯅ ꯍꯧꯖꯤꯛ ꯏꯅꯤꯁꯤꯌꯦꯜ ꯐꯦꯁꯇ ꯂꯩꯔꯤꯕ
One day awareness come free AYUSH health camp ama NAM Directorate of AYUSH 𝗙𝗵𝗶𝗏𝗏 makhada laiba AYUSH Hospital Keirao na sinduna ngasi Lilong Masjid Road ta laiba Madrasa Alia Markaz 𝗙𝗵𝗿𝗀𝗀 Pangthokhre. Awareness camp asida madrasa asigi satra amasung oza singa yauna punna miyoi chanimuk layengki. Patient singda hidak su free da pikhibaga loinana blood test su free da tauki. Awareness camp asida maruoina doctor ahumna luchingkhibaga loinana diet amadi lifestyle ki counseling su pibiki. Doctor sing adudi Dr. Nazia Hassan, Specialist Homeopathy, Joint Director AYUSH, Medical Superintendent in Charge, 50 bedded AYUSH Hospital Keirao, Imphal East, Dr. 𝗔𝗶𝗿𝗶𝗍𝗍, Specialist Homeopathy, 50 bedded AYUSH Hospital Keirao, Dr. 𝗙𝗿𝗵𝗵𝗏𝗏, Ayurvedic Physician, 10 bedded AYUSH Hospital Singjamai, Medical Camp asiga mari lainana, Dr. Singna asumna phongdorakli.
Ay isa si 50 bedded integrated AYUSH Hospital Keirao with MS neba, hojuse MS Manipuri ba. The some sina Dr. 𝗙𝗵𝗵𝗏𝗏 Ayurvedic Physician Specialist ne Ayurvedic yoina. Some homeopathic specialist ne. Ay sama sa homeopathic specialist ne ba. The post on MS on lay ba. Ada ako na ngasi awareness camp come help camp ne buko. The AYUSH ki matang din ba. Ako AYUSH aware oina de na public se. Ada AYUSH ki treatment se. Ako free din ngasi facilities de AYUSH free treatment ne ba. Free treatment sida medicine plus blood test everything free ne ba. Ada AYUSH aware oina ba ako AYUSH ki treatment se kyam kana ge patient sing da kyam kana ge da phangnan ge lag already allopathy de loin khang na re na ko adu AYUSH ki khang na ba khane awareness what ba do adu ekona sigi ona ngasi gi oina de alia madrasa ge da baktan de lag pa ne ba staff plus student gi da bakta lag pa ne ba ngasi camp si de ko se staff student pun mi chani mo so na ye hoje Alako patient kadi mo the medicine de line free da tawre ko free consultation free medicine ore blood test na darkar to patient khakki oina blood test taw ba adu so free ne ba adu patient kadi mo kidi blood test taw de darkar ta da ba treatment si holistic approach oye ba ko akoi sida side effect laite akoi medicine si herbal basis oi bang haktan ayam bana ko adu allopathy ga ko kadi am contrast oi khre yam treatment si yam different oi khre ba ada akogi AYUSH system siga makoi siga de khena bai se adum akoi medicine do khena ne the way of taking consultation do khena ne ko akoi sida ado everything different oi akoi se ko systems de ko na adu maina kidney failure or gasu ko diabetic or gasu magi stages ki makha pole yam advance oi khogade kai kidney failure su ko dialysis ki stage de khogade akona recover to khon bai se akodi adum ke papu de kona sure having amdri but also borderline the level kangbu de kon han tha lag normal level la prop khodi gamme ba duga diabetic organa akho diabetic 100% akho medicine na bhajan water hol man la ko diabetes bp asthma akho de ko the skin complaints cm de ko de am bhajan na advance na bhajan na women with healthness ki dos or wellness ki dos ko bhajan akho line de AYUSH ki de bhajan cure to hon mangamme duga hojiki emergency lines de ko shortest yam lai
I mean Dr. 𝗔𝗵𝗵𝗏𝗏𝗏 I am a homeo specialist AYUSH ko akoi gi system ze holistic oi ko doctor na already high bigre holistic means akoi ni yengu matam dane person as a whole yenge ba akoi di just ma ze skin gi kaino ma po me hairo boil amala ai hairo adu dang da focus taw de ba akoi di magi mental kamai tawi ko magi physical bills kamai tawi ma ze karam be mino magi ze yamna stress lei ba mira ko yam harawa mira yam saugan be mira adu da loina hangaga hidak pi ba du kitang case taking khar sang gani ba consultations of phajana dum pi ba ko counseling gum dum phajana dum tawe ba ko adumaina holistic approach to oe ba aduga akoi just magi ana badang lakthok te ba magi root cause to man adugi skin gi haka chabje kai dewe haka chaino adugi maram do thiraga maram du akoi na hidak pi ba adu oi automatically skin gi ana badum phagi ba adune ba holistic second na mal side effect yaude ba chap manai ba ko akoi gi kaino AYUSH ki system se plus amana cost effective hoiba means yam easily available hoiba ko public ta adune sigi benefit plus side effect yaudre plus ansik job the immunity am increase am oye adugi mi am toin toin na bdo mogi anabazu yam handharakani adugi benefit hoiba AYUSH aduga mi ze pa khangna ba oidri ba hojik se ko just allopathy ne yam na kaino dominant oidana adugi AYUSH ki system gi aphaba do magi better do kai kai aphaba lei kai kai kana lei noi dum lokson bi ona ko adui dam ta khoi laksa ban diagnosis first of all magi magi feature do yengani magi symptom do yengani magi je presentation yengani ko kamaina tawbano pomba oiro ko kaino mo oiro kamaina tawbano kayam di pa e kayam di pi kayam di chaw aduna yengani plus akoina amka hangani ko symptom amka hangani plus akoina examine amka tawrani palpation auscultation ko pair amka yengani ko adugi matungda amka confirm tawna akoina investigation amka pi ne blood test adure dum phajana dum adumaina dum diagnose dum ne tawe scientific way everything maze makuk ngauri haire dina ko makuk ngauri haire akoi mag se 𝗙𝗺𝗏𝗏 CBC test am ka taholani aduga serum electrolyte lay ko makung sum nari haire di makung khara sole khutsu khara jing laubale adu vitamin B12 water adu du yengani ko plus atopa fever oire khala koi typhoid test lay viral test lay TB test like adum yam the loina A to Z plus BP wange hairadi lipid profile test tawbe ko in case BP wanga ba sugar wanga ba adu de koi mostly complete blood test tawbe ba adu da CBC yawe ESI yawani plus lipid kidney function test ko thyroid function test ultrasound adu loina yawani ultrasound bodi akoi dadi hojikti yawdri adu so mapana test ke dum thai atai de A to Z adum loina yawe.
So regarding the more advanced stage of the allopathy, as actually the AYUSH system is very indigenous type of system, Indian system of medicine. It is 5,000 years old back. More advanced form were there in case of the our previous Vedic period, at the Vedic period. But as the allopathy advanced more in India, but in many states like Maharashtra, the general practitioner number is more that of the AYUSH than the allopathy. But in Manipur, the advancement, if we compare, the allopathy is more advanced. The more one reason is our Directorate of AYUSH is very in the initial phase since it has been developed from 2014, and moreover, only 10 to 11 years we have been providing the AYUSH service in Manipur. So aduna Manipur dadi yam initial phase te lady ba hojik aduna we have been incorporated in various health programs, public health programs like AYUSH Gram activities is also running since 2025. 𝗟𝗺𝗽𝗵𝗏, which is a geriatric health program. All the AYUSH practitioners also visit in the geriatric health camp. Various geriatric health camp, weekly health camp is also there. In AYUSH Gram also, we have Haingang block and the 𝗏𝗏𝗏𝗏 block is running. And 6 schools has been designated for the AYUSH Gram adoption. In this adoption, we have been practicing the lifestyle modification of the students so that we can assess and we can address the lifestyle disorders. Then another musculoskeleton project is running in 𝗡𝗏𝗏𝗏𝗏 Lamphel Hospital, which is the integrated 50 hospital, and only the Ayurvedic and the AYUSH practice is been emphasized for the treatment of the musculoskeleton problem. It is a very large project under National AYUSH Mission. Another project is we have monthly outreach health camp for every institute of the AYUSH. In Manipur, we have 350-bedded AYUSH hospital, only 350-bedded AYUSH hospital. One is at More, one is at 50-bedded Lamphel, one is at Keirao, who is Madam is the MS. Then we have 10-bedded AYUSH hospital in 6 districts: 𝗏𝗏𝗏𝗏, Tamenglong, Ukhrul, Imphal West में Singzamai, and another is Tamenglong also. Senapati maybe Senapati sulaire ko. So maina akoi gi AYUSH institution se yam zadri ba 10-bedded tataru khatanga ma aduga another AYUSH Health and Wellness center, that is Ayushman Arogya Mandir 14 is still running under Directorate of AYUSH. Aduna akoi gi huziki propagation phase se only in the initial phase ni mayam da akoina yum da changdana AYUSH mobile unit kind of Kaksingi yamna outskirt oiba mafamsing da changdana have the doorstep da akoi AYUSH service provide tawna ba kanna huzik initial phase se lairiba akoi started tawgi January 2024 gi last year transition phase da gi hauraga huzik still running oiri ko aduna huzik hena akoi gi AYUSH program sing je hena public health program se da yawshalaga mayam bada spread tawraga mayam sing da akoi AYUSH ki service sing je phajana provide tawna ba kanna hona jari aduna last 5 years study akoi na adum allopathy gi level da akoi su lakpa yana bagi pandam da akoi hena manpower recruit tawdana honji akoi 34 doctors khatang ne akoi all over state Manipur se da service tawri sa aduna awareness se moi ga akoi ga yam thina khena level da lairi ba aduna matam khara da di akoi gi layeng pathap sibu mayam na khangbira ba matung da di hena advance oiba akoi gi su form of system oiba yai ha bagi thajaba lai.